Tonight, the Omicron surge leaving many Americans on edge just 2 days before Christmas Eve. The variant now reported in all 50 states. New infections and hospitalizations skyrocketing in parts of the country. Americans scrambling to get tested as more than 100,000 travelers pass through U.S. airports every hour. Is it still safe to travel? And tonight, one more defense against the virus. Countries around the world also trying to contain the variant's rapid spread. The Netherlands back on lockdown for Christmas, and Israel now offering some residents their 4th vaccine dose. But health officials in South Africa say its Omicron wave passed as quickly as it grew, and they believe other countries will follow suit. Also tonight, verdict watch. Jury deliberations underway in the high-profile trials of Kim Potter, the former police officer who fatally shot Dante Wright, and Ghislaine Maxwell, who will spend Christmas behind bars. Maxwell jurors breaking for the holiday after asking the judge for testimony heard during the trial, what that could mean for the case. Our teams in New York and Minnesota tonight. James Franco breaking his silence, the actor speaking publicly for the first time since he was accused of sexual misconduct 4 years ago. The Oscar nominee's shocking admission about allegations he slept with his students. Desperate search, the 3-year-old girl vanishing from a playground on Monday. Authorities now calling her disappearance suspicious. And the extreme weather this Christmas week, a tornado touching down in Florida, plus the Pacific Northwest bracing for snow. We're tracking it all. Top Story starts right now. Good evening. I'm Kate Snow in for Tom. Tonight we begin Top Story with coronavirus concerns for a second Christmas in a row. The Omicron variant now in all 50 states. And despite the variant's rapid spread, more than 110 million Americans are on the move. U.S. airports seeing their busiest travel days since the pandemic began. And as families begin to gather, the country also facing a lag in testing. Many waiting online for hours, and those at-home tests are getting harder and harder to come by. Dr. Fauci today suggesting that we should uninvite unvaccinated guests as several states hit pandemic high hospitalizations. Europe also dealing with an Omicron surge. Paris nearing 100,000 cases a day. The Netherlands going back into lockdown. But there is good news from South Africa, where health officials there say their Omicron peak has already passed. And back here at home, the FDA greenlighting another tool to help fight the virus. Let's get right to NBC national correspondent Miguel Almaguer.
The FDA's emergency use authorization officially clears the way for the nation's first COVID antiviral pill. If taken within 5 days of the onset of symptoms, it could reduce hospitalization by 88% for those Americans already considered high risk. With tens of millions likely to become eligible, the treatment, which appears to fight off Omicron, now found in all 50 states, could be available in just days. But supply will be tight, at least for now.
As quickly as Pfizer gets the pills manufactured and delivered, we will immediately provide them to states and jurisdictions for distribution.
While a COVID pill is considered a pandemic game changer, it will not ease the crushing wave of patients flooding hospitals today. Falling into the depths of a deadly winter surge, the new numbers should be alarming if you're not vaccinated.
It just feels like no one is listening. I'm begging you to please get vaccinated.
For the second day in a row, new cases have topped 200,000. Nearly 1,400 people are dying every 24 hours. With the unvaccinated paying the greatest toll, Dr. Fauci suggested they be disinvited from holiday gatherings.
I think we're dealing with a serious enough situation right now that if there's an unvaccinated person, I would say, I'm very sorry, but not this time, maybe another time when this is all over.
As several states hit new pandemic records for cases and hospitalizations, medical centers are now scrambling to secure the only monoclonal antibody therapies that appear to be effective against Omicron. Though 2 new studies out of the UK show the variant appears to be less severe, it can still be deadly. In the New York area, it's accounting for upwards of 90% of all new cases. Tonight in states like Maine and Arizona, the National Guard and federal response teams are just arriving at hospitals.
We would just cry on the way home from work every day. The personal toll is very difficult. there's no shying away from that. It's truly horrible.
With California moving to require all healthcare workers get boosted by February, states and cities are trying to fend off new COVID closures. Disruptions to the NHL season mean their players won't participate in the Olympics. It comes as families ask, should they gather for Christmas?
So much about the safety of your gathering has less to do with the plane ride or the train ride that you're going to do to get there, and very much to do with the behaviors that you have in the week prior to your gathering.
Tonight, our second pandemic Christmas, in many ways resembling our first.
And Miguel Almaguer joins me now from Los Angeles. So, Miguel, during today's White House COVID briefing, I heard them give some guidance on holiday parties. What is it?
Yeah, Kate, authorities are saying Americans should try to avoid those large holiday gatherings, especially if people are inside and unmasked and you don't know their vaccination status. They say the risk is simply too high. Meantime, behind me here, Kate, those lines for testing remain long in pockets of the country. Kate?
Yeah, here in New York as well. Miguel, thank you. The Omicron variant does not stop at our borders. Countries around the world are dealing with their own COVID surges and shutdowns, and governments are trying to contain the spread right before Christmas. NBC's Richard Engel has the details.
Across the world tonight, no one seems to have figured out how to deal with Omicron. In the Netherlands, all bars, restaurants, and non-essential shops are closed. Since this week, the nation is locked down. Christmas parties canceled. But in Paris, you'd hardly know there's Omicron, even though France could soon have 100,000 cases a day. Authorities saying restrictions won't stop the spread, so they're focused on reducing serious cases. Italy is also letting people celebrate. Christmas on, but New Year's Eve celebrations are off. Italy's prime minister today said vaccines remain the best tool of defense. 3/4 of the deaths are among the unvaccinated. And in Israel, early and aggressive with vaccines, the government is now recommending 4th boosters to people over 60. But the World Health Organization today warned mass boosting could prolong the pandemic, saying vaccines need to be distributed to unvaccinated areas, like in Africa.
It's frankly difficult to understand how a year since the first vaccines were administered, 3 in 4 health workers in Africa remain unvaccinated.
But in Africa, like everywhere, there's vaccine hesitancy. Today in Nigeria, the government dumped 1 million expired doses into landfill. Kate, there might just be a silver lining here. All across the world, consistently, cases are going up. Omicron is spreading like wildfire. But people generally aren't getting that sick. That's happening here in the UK, where they are seeing more hospitalizations, but not many more people being sent to ICUs. And in South Africa, and this could be a major development, Omicron was first discovered in South Africa, and doctors there are reporting that cases are declining as quickly as Omicron initially spread. And a new South African study suggests that Omicron is 80% less likely to cause hospitalizations than the Delta variant. Kate?
All right, Richard, thank you. Some silver linings there. Turning back to the United States, we are in the thick of the heaviest travel days this week. The nation's roads and runways are very busy in what looks like more pandemic record-breaking numbers despite the Omicron variant. NBC's Tom Costello has a behind-the-scenes look now at what it takes to keep a single plane on time.
For the airlines, it all comes down to the final Christmas push. Every single hour, more than 100,000 travelers are passing through airports nationwide. Coming off the runway in Washington today, Flight 2565 from Dallas. Chocks under the wheels, and the countdown begins. They've got just 45 minutes to turn this plane around for its next flight to Orlando. 2 minutes after arrival, the cabin door opens. At 3 minutes, the cargo door pops. A minute later, the first bags are on the belt, just as 180 passengers start stepping into the jet bridge. Time is money. Being on time, a top priority.
Our number one job is to turn an airplane, and so speed is of the essence. It's so important. Everything we do is time.
The job here, sort the bags, priority bags, connecting bags, and then those that are staying here, get them to the carousel within 20 minutes. On board, the final passengers step off and the ground crew steps on. Caterers and cleaning staff moving fast, while underneath the fuel truck is hooking up. In the cockpit, the arriving pilots are rotating out.
I'd say 75% of the time we're changing aircraft.
American turns 8 flights a day at each gate here at Reagan National, more than any other airport.
Group 1 and active duty U.S. military personnel, welcome aboard.
20 minutes after arrival, the next flight's passengers are already boarding, as the next first officer does his inspection walk around.
What I'm here is sort of that last check to make sure that everything is the way it should be.
10 minutes before departure, the cabin door closes again. Blue skies helping the flight to Orlando to leave on time.
And Tom's with us now from Reagan National Airport. Tom, that's a high-wire act they're doing. A lot of precision there. What's the national picture like tonight? Any delays?
Yeah, I just checked with the airspace with the FAA and also FlightAware. We've got really minimal delays across the country, fewer than 400 this afternoon into the evening. That's really not bad for a day in December. We've got some wind delays in the Northeast around the New York area, some de-icing delays up in Maine to be expected this time of year. But for the most part, the country's looking pretty good. The question's now going to be, okay, what about the backside, right? What about the backside of Christmas, New Year's, the days after New Year's? We're going to be watching that very closely.
Yeah, I'm sure we will, Tom. Thank you. The timing of this Omicron variant could not be worse, surging right in the middle of this busy holiday season. Nearly 2 years ago, at the outset of the pandemic, New York was at the epicenter. Now, with the Omicron variant spreading, New York is once again getting slammed. NBC correspondent Vaughn Hilliard talked to people facing long testing lines and the fears of the growing spread.
Last time I waited for, I think, 3 hours, I gave up.
The country watching New York tonight as residents wrestle with how to maneuver testing lines, delayed results, changing plans, and the increasing burden of the Omicron variant.
Being in one of the most densely populated areas in the country, we can feel it every day. Take it seriously, believe the people that are in it.
In just the last week, new daily cases in the city have more than tripled, setting records. The state has the most daily average cases in the country.
I can't shop as I like, I can't walk as I like, I can't interact with people as I like. It's a life-changing experience.
These were the scenes in New York City in the spring of 2020, the first major American urban area to be devastated by the initial wave. But now, with Omicron on the rise, the streets are far from empty, but the demand at these testing sites still so high.
It's just scary to know that so many people I know have it.
Are your holiday plans adjusting at all because of this?
Yeah, I was going to see family, but I don't know if I want to now.
But it's also about more than Christmas with the family. For Saria Beltran, it's also her work.
I have to show up.
Are you an hourly employee?
Yes.
So if you get sick?
Then I won't get paid, and I have to stay home.
The same goes for Christian Aguirre.
We solely rely on being here physically at the store.
Aguirre crossing the street from his job at a clothing store to get tested. The results for PCR tests are often now taking several days because of the higher demand.
It's now extended, and people are kind of left in the lurch.
Ariel Flax already canceling her travel plans.
I decided to stay in New York and not travel to see family.
Because of Omicron?
Holidays. Yeah, for Omicron, and we have a lot of elderly relatives. You don't want to put them in danger.
And while healthcare professionals and the government are urging Americans to get a booster shot and take home testing kits, it's not been so easy.
I scheduled an appointment with CVS like 2 weeks ago, and they told me that they're out of stock.
You still haven't been able to get the booster?
Still haven't gotten the booster, and then I followed up. I was like, all right, do you have an at-home COVID test kit? And then they're like, we're out of stock as well. So I walked out at that point.
The realities and questions about the oncoming impact of the Omicron variant coming to a head just days before Christmas.
It's all around us. We can't escape it. Just have to learn how to live with it. You get tested, get your vaccine, get your booster.
Vaughn's with us now. Vaughn, you've been out there in New York all day, seeing it all. Is there any increase in testing sites, or what are you seeing?
Kate, the first federal testing site opened back up just today. 2 more are expected to open tomorrow. The state also announced today that they are going to be opening up pop-up locations at several subway stops. The state also said that they are acquiring 37 million at-home test kits. Of course, what we are seeing here in New York is expected to percolate across cities across the country in the coming weeks. Kate?
Yeah, Vaughn, I see the double mask going on there. That is not a bad idea at all. Thank you, Vaughn. For more on how this is all impacting hospitals and medical workers, I want to bring in Dr. J. Kevin Croston. He's CEO of North Memorial Health, which operates more than 24 healthcare facilities in the Minneapolis metropolitan area. Doctor, thanks for being with us. Appreciate it. Wish it were for a better reason. Yeah, you told my colleagues that every morning 200 to 400 people are waiting in emergency rooms around the Minneapolis area for a bed to open up. Is this wave right now just way over your capacity?
Yeah, we've been doing this since probably the middle of November. Every morning, people that have been admitted during the night to facilities all over the metro are kept in the emergency room waiting for a bed to open up. And so in the morning, we go through the daily process of discharging people and filling the beds right back up and starting all over again. As you can imagine, it's really backing up the emergency rooms as well. So care is really being delayed at this point.
Yeah, people who need other things other than COVID. You and other health system CEOs, you took out this full-page ad. I want to show it in newspapers across Minnesota saying, we're heartbroken, we're overwhelmed, this situation is critical. What drove you to put an ad in the paper?
Yeah, you know, it's a little bit of a story, but the group started collaborating in April of 2020 when the virus first hit. And we did this with the governor as well to try to figure out how we were going to carry on. And we've met pretty much weekly ever since. It became readily apparent to us that people are tired of hearing us talk about masking and social distancing, and they aren't really following those rules. And frankly, we're tired of saying it to them. But we were sort of challenged by the editorial page of the paper, the Star Tribune, that we weren't doing enough. And so we got together and we wanted people to see a perspective of what it's like to be a health system from the hospital side, because we believed if people saw what we were going through on a daily basis, maybe it would alter them and shock them into a state of reality and start to change their behaviors.
I want to understand, you said since November you've been having this daily hundreds of people trying to fit them into beds. So is this Delta? Is this Omicron now? Is it both?
Yeah, you know, I'd say it certainly was Delta earlier. What it is now, I'm not sure. We're all guessing that it's probably Omicron. But it also add that from the hospital perspective, we don't care. If they're coming to see us at that point in time, they're sick, and we treat them the same way. So the scary part is, we thought that we were going to go through a surge, and historically these surges were kind of come and go, and we'd get a little reprieve. This one's been now going on since, early October. And we thought we were going to have a little decline or a little moderation over the holidays. And yet now it looks like with this Omicron variant coming through that was maybe a false front, and we're going to have another surge to build on top of what we've already got. So it's a little disheartening to be here and understand what we're looking at and what we're facing going forward.
You said a minute ago, Doctor, that you don't think people quite understand what it's like. I'm sure we don't, to be in the healthcare field right now. Can you help us try to understand? What are you guys going through?
Yeah, the thing that I think everybody knows is that this pandemic is now 2 years in. We've got exhausted staff. They show up every day. We've lost a number of staff. Every health facility has. We're down nurses. We're down staff workers that help support the nurses. And yet they show up every day. They have to take extra shifts. We're constantly bringing in temp help to try to bolster the resources. People are really tired. And they're disheartened when they see behaviors out in the street and how they're going to try to keep people from coming in. Because once they get to the hospital, it's a really tough road for people. They're better just not getting sick, or, hopefully the new variant will be less so, but we just don't know how that's going to be. We just don't know how we can continue this. If you look at a traumatic event, a mass casualty event, it happens and you kind of get through it and it's over in a day or two. But this is like having a mass casualty event every day for 2 straight years. And people are really gutting it out. I have to say, through all that, however, I'm super proud of our people. They just continue to show up every day, do amazing work. They smile through their jobs. They help each other out. I've seen a level of cooperation around the state that we've never seen before. Competing health systems are really collaborating and making good things happen. I've been really proud to be a part of that CEO group that delivered that message to the community, because we're all really working on this together. And we're all seeing that this thing has got to turn the corner or we're in real trouble.
Yeah. Dr. J. Kevin Croston, it's wonderful to have you with us and give your perspective to us. So important. Appreciate it with North Memorial Health. Best of luck to you. Happy holidays if you can get some time off.
Thank you. And again, I want to say one more thing before we go. Get vaccinated.
Sure.
We won't see you if you're vaccinated. You don't get hospitalized if that's the case. So please help us out.
All right, Doctor, thank you so much. We are going to switch gears now. We're following two major trials, jury deliberations underway in the sex trafficking trial for Ghislaine Maxwell. Jurors also deciding the fate of Kim Potter. She's the former police officer charged with the killing of Daunte Wright in suburban Minneapolis. Our teams are on verdict watch for us in New York and Minnesota tonight. Shaq Brewster joins us now for more on that Kim Potter trial. Shaq, that jury still not reaching a verdict, right? But they asked a couple of questions. What do we know?
Yeah, those questions that we heard from the jury was the last communication that we've gotten from them, and that happened well over 24 hours ago at this point, but it did signal some difficulties in trying to reach a consensus. That first question we heard was the jury asking if the jury cannot reach a consensus, what guidance can the court provide on how long they should take and what steps they should make, and the judge didn't really answer it directly. Instead, the judge simply reread parts of the jury instructions, that 14-page document that each of the jurors have at their disposal during the deliberation. She simply reread a section of that and then let them go. But before she did, she answered the second question, which was them asking for more access to the gun that Kim Potter used in the shooting. They had that gun and they had the taser that was strapped to her waist. They had access to it, but the gun had zip ties around it, so they couldn't have full access to it. So they asked for a procedure that would give them more access to that firearm. The judge allowed that, gave them direction on how to get access to that. It's an unloaded firearm, so it's a safe access that they have to it, but that way they have access to the handgun that was actually used. But again, we haven't heard anything from them today.
Well, and I guess what everybody's wondering is those questions you just described and wanting to see the gun, does that indicate anything? Do we know whether this jury might be leaning one way or another?
Yeah, when you talk to experts, they really don't know, and they admit that they don't know. You know, one thing that we do know is that the prosecution throughout the closing arguments and throughout the entire trial really emphasized the jurors the differences between a gun and a taser. That's really what they say this case comes down to. Differences in color, differences in weight, differences in grip and texture. So those two exhibits, pieces of evidence, they were in the jury room. So this at least suggests that they're trying to get access to it. They potentially want to hold the firearm and feel those differences for themselves, but we really just don't know because they're locked away having those private deliberations, and even after those questions were asked, even if they got that access, we just haven't seen them since.
Shaq, thank you. And now to the other high-profile case that we're watching for a verdict, the trial of Ghislaine Maxwell. The jury still deliberating, working to decide if the former British socialite is guilty of 6 counts in connection with convicted sex offender Jeffrey Epstein. Megan Fitzgerald is watching all that for us. Megan, hi, good to see you. So the jury during deliberations, they've gone back to the judge and asked for evidence that was presented in the trial. What are they asking for?
Kate, that's right. So yesterday, jurors asked for the transcript for 3 of the 4 accusers that the prosecution called to the witness stand. Now, these were their star witnesses. These women testified that when they were teenagers, Ghislaine Maxwell recruited and groomed them for purposes of Jeffrey Epstein sexually assaulting them. Today, they asked the judge for a 4th transcript. They also wanted to see the notes that the FBI took when they interviewed one of these accusers back in 2007, Kate.
And what are experts saying about all those asks? Does that bode well for Maxwell, for the prosecution? Do we know?
You know, it's a good question. And we asked legal experts. They say, you know, at this point, it's all speculation. But what it does show, they say, is that these jurors are doing their due diligence. They are going back through the evidence before they render a verdict, Kate.
So no verdict today, obviously. 3rd day of deliberations. Holidays coming right up. Do we have a timeline for when this could all come down?
So the judge asked the jurors today if they would be interested in returning tomorrow for deliberations, and they returned a note to the judge saying no, thank you. So this means that jurors will now return on Monday to begin deliberations once again. Kate?
Okay, Megan, thank you. And as we head into a busy holiday weekend, let's get a check on the weather. Another tornado reported in the south, kicking things off. An EF1 tornado touching down in Fort Myers, Florida. Strong winds damaging dozens of homes and cars. Crews working to clear away fallen trees there. And out west, heavy rain, mountain snow making its way inland. Let's get right to NBC News meteorologist Michelle Grossman, who joins us now to time it all out for us. Michelle.
Hi there, Kate. Yeah, we are looking at a lot of snow out west. We're going to be measuring in feet, even up to 8 feet in some spots. And then on contrast, we're looking at barbecue weather in some parts of the nation. So let's first start with our winter weather alerts. We have advisories, watches, and warnings. You can see tons of them out west from the Pacific Northwest down to Southern California, where we're looking at the higher elevation snow in the Cascades and also the Sierras. So this is a setup. As we go throughout tomorrow, we'll see that first front come through. We've had so many fronts coming through in the month of December. And that's going to continue this week. So that rain spreading to Southern California, Los Angeles. You can see those darker colors there, the oranges, the yellows, indicating some heavy rain in Los Angeles. And then that snow accumulating up to 10 feet in some spots. That's going to take a hike to the east, and then we're going to see another system move onshore, and that's going to bring more rain on Friday and even into Saturday. So your rainfall forecast, we could see nearly half a foot of rain in some spots. And then as that snowfall forecast, it's going to be some happy skiers out there, because we're looking at generally 2 to 3 feet of snow, but again could see over 8 feet in the Sierras. So certainly we're going to see some impacts in terms of the airports. We're looking at San Francisco, moderate, Los Angeles as well. That's Thursday. And then a major impact in Seattle. By Friday, this is Christmas Eve. You see a lot of red on the map. Seattle, Salt Lake City, Los Angeles seeing that rain. But the East Coast looking really, really good. Look at these temperatures, though. We're looking at well above normal. This is temperatures that you mainly see in July, and this is going to be close to Christmas. So tomorrow, 77, 26 degrees above normal. By Friday, 80 degrees in Austin, 82 will be the record, and New Orleans, 81, and that holds true for Christmas Day as well. Kate?
All right, Michelle, thank you. Still ahead tonight, James Franco speaking out, the actor breaking his silence on allegations of sexual misconduct, talking for the first time what he said about sexual relationships he had with students. Plus, the search for a 3-year-old girl who vanished from a playground, authorities going door to door, and the FBI now involved. Welcome back to Top Story. James Franco back in the spotlight, giving his first interview since 2018 with SiriusXM's Jess Cagle. He has not spoken publicly since facing sexual misconduct allegations. The actor settled a lawsuit on those same allegations in June. Here's Isa Gutierrez with more.
Tonight, actor James Franco is breaking his silence about sexual misconduct accusations made against him. The allegations from students at an acting school he ran and taught at first came nearly 4 years ago.
At that moment, I just thought, I'm going to be quiet. I'm going to pause. Did not seem like the right time to say anything. There were people that were upset with me, and I needed to listen.
Franco speaking out on SiriusXM's The Jess Cagle Show. In 2019, the Oscar nominee was sued in a class action lawsuit by 2 former students who attended the Studio 4 acting school, which Franco ran from 2014 to 2017. In the lawsuit, the former students alleged that they and others were coerced into filming overt sexual acts by Franco and his partners.
The stupidest thing I did, or one of the stupidest things I did at the school, was I called one of my classes, a master class, sex scenes. It was not about sex scenes. I was not teaching people how to do sex scenes or intimate scenes or anything of that nature. It was a provocative title. I'll admit, I did sleep with students. I didn't sleep with anybody in that particular class, but over the course of my teaching, I did sleep with students, and that was wrong.
People listening to this will say, how could you not see that there would be a power imbalance among a teacher who's not just a teacher, but is James Franco, like a very, very famous, powerful actor and producer and a student? How did that power imbalance, how were you not aware of that?
I suppose at the time, my thinking was, if it's consensual, okay. of course I knew, I talked to other people, other teachers or whatever, like, yeah, it's probably not a cool thing. At the time, I was not clear-headed, as I've said. So I guess it just comes down to my criteria was like, if this is consensual, like, I think it's cool. We're all adults.
The allegations against Franco first surfaced in 2018, following the Me Too reckoning in Hollywood. At the time, Franco denied the allegations.
The things that I heard that were on Twitter are not accurate, but I completely support people coming out and being able to have a voice because they didn't have a voice for so long. So I don't want to, shut them down in any way. It's I think a good thing, and I support it.
Then earlier this year, he agreed to pay more than $2 million to settle the suit, according to court documents seen by NBC News. A joint statement issued on behalf of the actor and his former students said, quote, while defendants continue to deny the allegations in the complaint, they acknowledge that plaintiffs have raised important issues, and all parties strongly believe that now is a critical time to focus on addressing the mistreatment of women in Hollywood. Studio 4 closed in 2017. Now, Franco's saying he's been in treatment for sex addiction since 2016.
Isa Gutierrez is with me now. Isa, I have to say I was cringing through some of that. Have we heard from the former students who brought the accusations in the first place and they settled that lawsuit with him?
Well, Kate, one of them actually posted to Twitter today after this interview with Franco came out. She wrote in part, quote, apologies are meaningless until active steps towards harm reduction are taken and directed towards survivors specifically. General statements of sorry or I was wrong or I love women, etc. do nothing to actually help those who've been harmed. Kate?
Isa Gutierrez, thank you. When we come back, the urgent manhunt, the man now on the run with his 3 young children, and authorities say he's wanted for disturbing crimes in another state. And we continue our coverage of the Omicron surge, how soon you should get tested if you're planning to see your family for the holidays. That's up next. Now to Top Stories news feed, and we begin with a manhunt in Texas. Police are looking for Jonathan Wright, who has multiple warrants in North Carolina for sex crimes against minors. Wright and his wife were reportedly on the run with their 5 children when their car broke down. Deputies stopped his wife and the 2 oldest children, but he is now believed to be on foot with his three youngest children. An Amber Alert has been issued for the kids. Tesla is now facing a federal probe. U.S. regulators say they've opened a formal safety investigation into nearly 600,000 Tesla vehicles that allow users to play video games on a dashboard touchscreen. The investigation coming after a New York Times report found a driver could use the feature while the car was in motion. Tesla did not immediately comment. President Biden has extended a pause on student loans through May 1st. Those payments were put on pause back in March of 2020 and were set to restart on February 1st. Interest rates will also now remain at 0%. President Biden saying the extension is due to a recent surge in COVID-19 cases. With the continued spread of the Omicron variant, what precautions should we all be taking before we come together to celebrate the holidays? Joining us now with some advice on how to get ready for the holidays, what to do, is Dr. Aditi Nerurkar, a physician at Harvard Medical School. Doctor, thank you so much for being with us.
Thanks for having me.
So we've heard a lot about home tests, right? And we've heard that a lot of people can't get them. But if you're lucky enough to have one, when is the best time before you're visiting with family to take that at-home COVID test?
So as you know, at-home COVID tests have been in short supply in many parts of the country. And ideally, if you are to gather for, say, Christmas, taking a home test, everyone should take a rapid test the morning of the event, and if it is positive, stay home. Understand also that the home test may not be positive, and if you have symptoms, whether the test is positive or not, do not engage and interact with other people. Stay home for safety's sake. It sometimes takes 3 to 5 days after symptoms for the home test to be positive.
Right. Okay, that's good advice. We've heard mixed messages a bit about airports and flying. How safe would you say it is to get on a plane right now?
You know, it's interesting because those two are very clearly stratified. So an airport, for example, is a harbinger of infection. We know it's a real hotbed of transmission because we have a large amount of people, crowds of people with poor mask adherence. And because Omicron has a 70 times transmission compared to Delta, and it's more contagious than measles, airports are quite risky. However, the airplane, the flight and the cabin itself is relatively safe. They have HEPA filters in place. The air is circulated 5 to 6 times every minute. And so the real concern in airline travel is less so the flight itself, but more so the airport.
That's interesting. A lot of people looking forward to seeing their families. Should we be concerned about older relatives, especially if we have little kids? I know a lot of my friends have kids who can't be vaccinated yet.
You know, the really interesting way to think about this is quite clear, and you can think about it on a spectrum. Risk stratification, especially during the holidays and with travel, is on a spectrum. So the green, all systems go, is when everyone is vaccinated and boosted. There are no unvaccinated minors, like you suggest, and no high-risk people with chronic medical conditions or who are immunocompromised. If everyone is gathering that is in that category, vaccinated, boosted, healthy, and at low risk, it is safe to gather. However, those we are most concerned about are people who are vulnerable, unvaccinated minors under the age of 5, elderly people with chronic medical conditions who may have been vaccinated, and people who are immunocompromised. If you have any of these in your family, I would caution against traveling and meeting them this holiday, particularly because we are seeing such numbers during this winter surge.
So tough. Dr. Narukar, I hope you have a healthy and happy holiday. Thanks so much for being with us.
Thank you.
Let's turn now to COVID news coming out of Israel. The country there set to be the first to offer people a 4th dose of the COVID vaccine, continuing their reputation as trailblazer in COVID protocols. NBC's Raf Sanchez has that story.
Tonight, a sign more shots may be on the way, even if you've already had 3. Leaders in the U.S. have been urging people to get a first COVID vaccine dose for a year, and now they're pushing for boosters. But Israel, ahead of other countries, announcing Tuesday they're preparing to give some people their 4th dose. Who will be eligible? People older than 60 or with compromised immune systems, and health workers, if it's been at least 4 months since their 3rd jab, all in the hope that these shots will slow the rapid spread of the Omicron variant. Israel will be the first country to offer this.
We are seeing some increase in the number of people being infected as more and more time passes since they received the boosters.
An advisor to the Israeli government told NBC News there's no single data point that led to the decision, but several factors came together.
The fact that there's an upcoming very big wave of Omicron, together with evidence for seeing some waning effect of the 3rd booster, and finally an uncertainty still on the severity of disease that Omicron will cause.
This is yet another example of how Israel has been ahead of the curve at so many points during this pandemic. The Prime Minister of Israel pointing out in a statement, the citizens of Israel were the first in the world to receive the 3rd dose of the COVID-19 vaccine, and we are continuing to pioneer with the 4th dose as well. The country was also one of the first to allow the vaccination of children 5 and up last month. Earlier this year, Israel was quick to get a large portion of its population vaccinated, and also early with a green pass this spring that opened up businesses for vaccinated people. The government moved quickly against Omicron, barring foreigners from entering Israel on November 25th, and this week expanding a list of high-risk countries to include the United States. So is it all working? Well, the results are mixed. Israel fared far better than the US and European countries when it came to hospitalizations during the Delta wave. But the death rate was worse than in the UK and the EU. Now, as cases surge elsewhere, Israel seems to be avoiding the worst of it. For now. Now, the recommendation for the 4th dose still needs to be given final approval by Israeli health officials, but that's expected to happen soon, and shots could be going into arms as early as next week. Kate?
Raf, thank you. Now to a promising development back here in this country. Army scientists are working on a new vaccine that they say could be effective against all known COVID-19 variants, even Omicron, as well as previous coronaviruses like SARS. Joining us to talk about what this could be, if it's a breakthrough, and NBC News Pentagon correspondent Courtney Kube is with me. Courtney, this vaccine has been in development for a couple of years now. What do we know about what the Army's been working on?
Yeah, that's right, Kate. So early on in the pandemic, nearly 2 years ago now, the U.S. military got some samples of COVID and they started working on this vaccine. So this is occurring at Walter Reed. A lot of people think of Walter Reed as this enormous military medical facility in Bethesda, but in fact, there's actually a large research component as well. So they started working on a vaccine that isn't exactly like the ones that we've all come to know so much about in the last year and a half. In fact, this one was not just trying to target and protect against the COVID that we all have known since the early days of the pandemic in 2020. But the ultimate goal is that theoretically, it could actually protect against future variants of COVID as well that we don't even know about yet. So one of those that this could be able to protect against is Omicron, which we're hearing so much about right now. But the idea is that this one could protect against mutations of COVID going forward. It also, in fact, as you mentioned, it's not just a protection against COVID, but it also protects against SARS. So again, they're still relatively early on in the testing of this, but so far the outcomes are very positive. They are hopeful, if not optimistic, that this may actually be able to prevent against future variants of COVID.
Right. That could be huge. So how far along in development are we talking? What are the next steps?
So it's gone through phase 1. We're expecting to hear what the military calls their analysis or, the outcome of the first phase of this. But everything that we're hearing is that in the next few weeks, we will hear positive results from that it was successful in protecting against it. But next thing, they have to start testing it in humans. And while that may not seem like that's such a big hurdle, think of where we are in this pandemic. Many, if not most, Americans have either been vaccinated, exposed to COVID, they have some level of exposure to coronavirus. Well, they need to test this on people who have not been exposed, who have not been vaccinated, so who have no COVID in their systems. That's going to be one of the hurdles to the next step of testing this for phase 2 and phase 3. But again, so far they are very optimistic, the U.S. military in this research facility, that they will be able to provide in the coming months, so not anytime too soon, but in the coming months, that they may be able to provide a vaccine that will provide a much broader spectrum of protection for people.
All right, Courtney, thank you. Coming up, the search for a 3-year-old in Texas. Her family says she went missing from a playground earlier this week. The massive reward now being offered for information. Next tonight, multiple agencies, including the FBI, are searching for a missing 3-year-old who police say went missing from a San Antonio playground Monday afternoon. NBC News correspondent Maura Barrett has the story.
Tonight, San Antonio police eagerly searching for a 3-year-old girl, Lena Sardar Kill, who went missing from a playground on Monday. Police issuing an Amber Alert, calling the disappearance suspicious.
We are not stopping at the end of the shift. We'll continue to do this for the long haul if it's necessary.
The little girl's family, Afghan refugees who came to the U.S. in 2019, according to the San Antonio Center for Refugee Services. Lena, last seen playing at an apartment complex. Police say her mother stepped away briefly, but when she returned, her daughter was gone.
There were other folks in the playground with their children, and we're trying to identify all of them, but she wasn't left alone by herself. There were other folks in the playground.
San Antonio police checking cars going in and out of the complex and going door to door at all 300 units. The FBI even stepping in to help. The police asking for its child abduction rapid response team, though the department says they're not ready to call it an abduction case yet. The police also set up 2 command centers and are scouring security video. The Islamic Center of San Antonio offering a $10,000 reward. Tonight, the chief saying,
the community at large has been very, very helpful in our efforts to find Lena. We've been putting things out on social media in that dialect, in Arabic.
What's the timeline look like in terms of what needs to be done or the likelihood of finding her 48 hours later or more after disappearing.
Whether she wandered off or was taken, the odds of her surviving or being found safely are going to go down as time goes on. This is a little girl who cannot fend for herself.
So sad. Maura joins us now. Maura, any other details that we can tell the viewers about Lena?
Well, Kate, when I was speaking to Dr. Fox, she noted that there is important research on missing persons that shows that the more media coverage there is, the more that is spread on social media with details like this can only be more helpful for police, though police did say today that they haven't been very successful in their search. And so it's important to note that Lena was last seen wearing a black jacket, a red dress, and black shoes. The 3-year-old girl is about 4 feet tall and weighs 55 pounds. Kate?
All right, Maura, thank you. We'll hope for the best. When we come back, a miracle surgery. Doctors telling a pregnant mother her child had a tumor growing on his heart. The incredible surgery in utero to save his life. Stay with us. Finally tonight, what one Pennsylvania family is calling a Christmas miracle. Sam Drinnan was 6 months pregnant when she learned that her fetus had a malignant tumor growing on his heart. Normally, that tumor would be fatal, but after a groundbreaking procedure, little Rylan is home, safe and healthy with his parents tonight. This is their incredible story.
5-month-old Rylan Drinnan loves to lie under the Christmas tree and stare up at the lights. His parents, Sam and David, consider him a Christmas miracle. He's also a pioneer, a living example of what modern medicine can do.
It wasn't until our second anatomy ultrasound and they said that they were going to bring the doctor in to talk to me.
Did you know in that moment?
Usually when they say the doctor is coming in to talk to you, you know something's wrong.
Yeah. At 26 weeks, Rylan had a malignant tumor blocking the function and development of his tiny growing heart. For him to survive, doctors would have to get at the tumor and remove it.
Can I ask point blank, like, did they say that if you didn't have surgery, he might die?
Yeah.
I think it was like in 2 weeks, he probably would have died.
Oh, look at this.
Sam works in a surgical hospital herself, so she understood all too well when doctors at the Cleveland Clinic said they needed to perform in utero fetal heart surgery, something that had only been successfully done once in the world before.
We're dealing with a situation that just doesn't present itself. There's not tons of medical literature about this. You know, it's a handful of cases, and so we want to be sure that we're going to do the right thing.
Dr. Daryl Cass led a team that first had to operate on mom-to-be Sam, opening her abdomen, then her uterus, in order to operate on little Rylan. They pulled his tiny arms forward to access his chest cavity. Dr. Cass called on surgeon Dr. Hani Najam to remove the dangerous tumor.
My first response to him is that I've done these after birth, and can you get me to that fetus? I could do this procedure, but you gotta have to get me to that fetus in the uterus so I could do something about it.
When they said we might do in utero surgery, Sam, what did you think of that?
It was shocking and overwhelming.
After 4 hours of delicate surgery, the tumor was out and Rylan back in place in what doctors call the best intensive care unit, the womb.
We talked every day. I would talk to him all the time. I would just tell him that everything's going to be okay and I got you. We're going to get through this and you're going to come out strong.
Rylan spent 10 more weeks growing and recovering inside mom. When Sam went into labor, they were nervous about whether his heart would pump on its own.
I was his bypass machine, like keeping him alive.
Because he was attached to you, yes, and your heart was doing all the work.
Yeah.
Mm-hmm.
So the minute he comes out and they cut the umbilical cord,
he's on his own.
Yes.
What happened?
He screamed.
Yeah.
He took over. He knew. He was like, it's my time to shine. Let's go.
Rylan was healthy. Things were so positive, the Cleveland Clinic staff teased Rylan's Pittsburgh Steelers fan parents. The doctors told me that they dressed him in Cleveland Browns gear.
Yes, they did.
They did.
We gave them permission because they did save his life.
Right. When he gets older, they look forward to telling him the incredible story behind that scar on his chest.
What will you say, Sam? That you went through so much, so little, before you even knew what life was. Mm-hmm. And now you're helping the medical community in ways you never thought possible.
But in the meantime, they're focusing on celebrating their first Christmas with the best present they could ever ask for. It's a time of year when we think a lot about giving and appreciating family.
Oh, absolutely.
Just wonder how you guys are feeling now.
We're thankful for the doctors up at the clinic that took care of him and saved his life. We're thankful for our family for helping take care of me and him. Every time I see him, it's a feeling that you never thought you would have, knowing that he could have been gone, and that I get to hold him every day and just keep him as happy as I can.
The sweetest baby. Ryland's doctors say that his heart seems to be functioning just fine. He will be getting some surgery in February to fix the bones in his chest cavity. But tonight, his parents, Sam and David, they are just enormously grateful that their little boy is thriving. He's actually working on rolling over and full of laughter. That is our broadcast on this Wednesday night. Thank you so much for watching Top Story. I'm Kate Snow in New York. Have a great night.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.